ओंटारियो ਦੇ ਟੀਕਾ ਵਨ ਟਾਸਕ ਫੋਰਸ ਦੇ ਮੁਖੀ ਜਨਰਲ ਰਿਕ ਹੀਲਰ ਨੇ ਕੋਵਿਡ ਵੈਕਸੀਨੇਸ਼ਨ ਦੇ ਦੂਜੇ ਪੜਾਅ ਬਾਰੇ ਵੇਰਵੇ ਸਹੀ ਜਾਣਕਾਰੀ ਦਿੱਤੀ ਹੈ। ਉਹਨਾਂ ਕਿਹਾ ਕਿ ਮਾਰਚ 2021 ਤੋਂ ਦੂਜੇ ਪੜਾਅ ਦੇ ਸ਼ੁਰੂ ਹੋਣ ਦੀ ਉਮੀਦ ਹੈ। ओंटारियो सरकार ने 8.5 मिलियन लोगों को कोरोना वैक्सीन देने का टीचा मिथ्या है, जिन्हां विच हेल्थ वर्कर और बजुर्ग भी शामिल ने। यह प्रक्रिया जुलाई 2021 तक चलेगी।
As of yesterday morning in Ontario, we had received 147,000 doses of Pfizer, and we had used, as of yesterday morning, just over 140,000 of those, and we're continuing to vaccinate people with the Pfizer that we had while we awaited the next shipment. That shipment arrived yesterday. Just less than 50,000 doses of Pfizer, and yesterday afternoon and yesterday evening, it was already being put into the arms of people in those first two priority groups, those in most vulnerable circumstances and those of our healthcare workers. And we wanted to get it to them as quickly as we possibly could. We have ramped up the capacity to flow the vaccines through the 19 hospitals that are running mass vaccination clinics. We are piloting a project with the City of Toronto and Chief Matt Pegg to open up a clinic on the 18th of January to write the playbook for mass vaccination clinics outside of hospitals to utilize around the rest of Ontario. And while we're doing that, we're running an operation called Operation Remote Immunity, where we are getting vaccines into those in most vulnerable circumstances, particularly in those isolated fly-in communities. Some of them along the James Bay, some 31 of them that we want to get vaccinated because of their fragile circumstances. And we started last Thursday with needles in arms and several long-term care facilities in those communities, and vaccinated 47 out of 51 residents, for example, and did more in Sioux Lookout itself with long-term care facilities, and now moving to vaccinate the healthcare workers in the hospital there. All this to ensure that those in isolated communities and fly-in communities in particular have received a level of protection that they have not had till now. And we know that they are vulnerable. We know their medical system is not as robust as we all would like it to be. And if COVID-19 is introduced into their communities, it is going to be a massive tragedy, and that we want to help preempt. We have more than 175 people now as part of our team for that operation vaccinated, awaiting their second needle, and prepared to be the vaccinators and roll out in significant numbers that vaccination program, Operation Remote Immunity, into the 31 isolated communities starting on 1 February. And while we're doing that, we took the Premier's challenge and pivoted what we were doing because of our ability now to move Moderna, which had arrived as of last week, and because of our ability in the middle of the week to move Pfizer from the hospital sites where we receive it. We took the Premier's challenge to vaccinate all of the long-term care homes and the high-risk retirement homes in the four areas of Toronto, York, Peel, and Windsor, Essex. We are 75% along completing that mission. Some of the homes will be completed by 12, some of the regions will be completed by 12 January, others 15 January, 16 January, the last one by 18 January, we believe, and we will meet the Premier's challenge of vaccinating the residents and the staff in those long-term care homes and high-risk retirement homes who want to receive the vaccine, and giving them that incredibly greater level of protection and eventually immunity from COVID-19.